Hello, I'm Dr. Rob Rozbruch from the Hospital for Special Surgery, and I wanted to spend a few minutes talking to you about subtalar distraction for the treatment of subtalar joint arthritis. This is a joint preservation approach to arthritis of the subtalar joint and is an alternative to subtalar fusion, which eliminates motion in the subtalar joint. I'm going to illustrate this by showing you examples of two patients, Marcy and Joel. These are my two patients who have given permission to show their cases and to show their images. Here is pictured Marcy, who injured her subtalar joint years prior, and you'll notice that there's subtalar arthritis and narrowing of the joint space, and there's pain in the hindfoot. On the front view x-ray, you'll also notice the narrowing of the subtalar joint. At surgery, I performed joint distraction, inserted stem cells, debrided and removed osteophytes, and performed microfracture of areas that have full thickness loss of cartilage. And you'll see an improvement in the subtalar joint space. At a follow-up, you'll notice on this standing x-ray there is a significant improvement in the subtalar joint space, and it's maintained distracted even with weight bearing. This is what the fixator looks like, and it allows independent distraction at the subtalar joint and at the ankle joint. Marcy is managing with her external fixator. Weight bearing is tolerated, and even enjoying some time in the pool. This is a recap of what it looked like before, with severe arthritis, joint space narrowing, subchondral density. And afterward, you'll notice a substantial improvement in the joint space with regenerative tissue and a normalization and improvement of the subchondral density. She's gotten back to her active lifestyle and is without pain. Next, I'd like to show you the example of Joel, who also injured his subtalar joint years ago. And you'll notice the joint space narrowing and arthritis. Now, you'll notice on the left side, the tibia lines up with the heel bone, but on the right side, there's lateralization or valgus of the heel. So this is also associated with hindfoot valgus and some flat foot. At surgery, we perform ankle distraction as well as arthroeresis. The arthroeresis is designed to help correct the valgus deformity through the subtalar joint, and you see the distraction with the improvement in the joint space. This is what the fixator looks like. Standing x-ray shows maintenance of the distracted joint space. This is Joel as he is managing during the time that he wears the fixator. Again, the fixator allows independent distraction of the subtalar joint and the ankle joint. The distraction offloads the joint and allows regenerative tissue to heal the diseased joint, and also allows improvement in the subchondral density of the bone. A recap of Joel before, with joint space narrowing, subchondral sclerosis and increased density, and afterward you can see an improvement in the joint space as well as the density of the subchondral bone. Joel has gotten back to his active lifestyle and is without pain. If you're a professional and you want to learn more about these types of reconstructive cases and other joint preservation strategies, this may be a good resource for you. I want to thank you for your attention. I hope this has been informative lesson about joint distraction of the subtalar joint for arthritis, a joint preservation technique, and an important alternative to subtalar joint fusion.